Welcome everyone to the third month progress report of Translational Medicine Center. My name is Andrea Lancz and I would like to present my PhD theme, which is Management of Itching in the Treatment of Chronic Spontaneous Urticaria and Prurigo Nodularis. I'm a first-year PhD student and a medical doctor. I'm working as an internist in the Department of Internal Medicine in Szombathely of Markusovsky Hospital. I will make my PhD with the help of Department of Dermatology of Semmelweis University. As you can see, I have a lot of helpers. My vision is that patients with prurigo nodularis or chronic spontaneous urticaria could have a better quality of life. Therefore, my mission is to optimizing the treatment of these diseases. Currently, I have two ongoing projects. The first one is comparing the safety and efficacy of biologics in prurigo nodularis, and the second one is investigating the safety and efficacy of biologics in chronic spontaneous urticaria. Now let me talk about my first project, which is a systematic review and meta-analysis. Prurigo nodularis is a chronic skin disease that usually presents as multiple, very intensely itching nodules wrapping on the extensor surfaces of the extremities and the trunk. It is associated with a significant disease burden, with the majority of patients suffering from anxiety, depression, and sleep disorders. Many associated conditions are now in the background, but their coexisting or pre-existing role hasn't been established. Only estimated prevalence is available, but the real number of the patients are probably higher. There are a lot of therapeutic options, but the conventional therapy's effectiveness is questionable, and some of the drugs may cause serious adverse events. In recent years, new biologic agents have been discovered, and in cases where the conventional treatments are ineffective or poorly tolerated, the use of biologic agents has shown promise. So, our aim is to find the best therapy for prurigo nodularis patients. Our clinical question is, what is the safest and most effective therapy in prurigo nodularis? In our study, we will use the PICO framework. Our population will be patients suffering from prurigo nodularis, and we would like to compare the biologics to the conventional treatment or placebo. We will observe the efficacy outcomes, for example, reduction of the itch, reduction of the number of the nodules, improvement in sleep, or improvement in mental health. And we will observe the safety outcomes, the adverse events too. Our hypothesis is that biologics are more effective and safer compared to the conventional therapies. So, our clinical implication is to achieve the early use of biologics in the treatment of prurigo nodularis. We have carried out a systematic search on the 20th of November in the three main databases with these two domains. The first one is about prurigo, and the second one is about all the existing and under-investigated treatment. We have found almost 5,000 results, which, after duplication removal, remained 3,715 texts. Currently, I have finished my own title abstract selection. Now I would like to talk about my second project, which is investigating the safety and efficacy of biologics in chronic spontaneous urticaria. Chronic spontaneous urticaria is defined by the presence of recurrent urticaria or angioedema or both for a period of 6 weeks or longer. It is a self-limited disorder in most of the cases, with the average duration of the disease of 2 to 5 years. But patients suffering from chronic spontaneous urticaria usually have a low quality of life. The estimated worldwide point prevalence is 1%. The first-line therapy to this disease is the second-generation antihistamines. But some patients have urticaria refractory to this treatment. In these cases, the targeted monoclonal antibodies are necessary. Omalizumab is the first and only FDA-approved targeted therapy to this disease. It targets the free IgE. Although omalizumab has been an important addition to the therapeutic armamentarium for the management of this disease, there is still a significant percentage of patients who doesn't respond to the combination of omalizumab and antihistamines. With the expanding knowledge of the unique pathogenesis of this disease, new biologic agents are in development and the preliminary results are promising. So our aim is to find the best, most effective treatment for chronic spontaneous urticaria. Our clinical question is, what is the safest and most effective therapy in chronic spontaneous urticaria? Our population is patients suffering from chronic spontaneous urticaria, and we would like to compare to the novel biologics to the conventional therapies or placebo. We will observe the efficacy outcomes with the urticaria activity score and the safety outcomes, the adverse events too. Our hypothesis is that novel biologics are more effective and non-inferior in safety compared to the conventional therapies. So our clinical implication is to early use of biologics in the treatment of chronic spontaneous urticaria. We have carried out a preliminary research with these two domains. The first one is about the synonyms of chronic urticaria, and the second one is about the systemic therapies. As you can see, I'm the very beginning on my second project. So in summary, this is my two ongoing project, which we are hoping to submit by May and June next year. Thank you for your attention, and let me say goodbye with the words of Theodore Roosevelt: believe you can, and you are halfway there.
Congratulations for the lecture. Any question from the audience?
Congratulations, a wonderful talk. Yeah, my question would be that you mentioned that one of the major outcomes is the assessment of itch. And what kind of measures exist to objectify the degree of itch?
Thank you for your question. There are several questionnaires according to the itch. One of these, the worst itch numeric rating scale, peak Puritus numeric rating scale, and Puritus numeric rating scale. This is different scales, but the ranking are the same technically. 0 to 10 measure. 0 means no itching, 10 means the worst itching possible, so we can compare the itch measures in the different studies.
And among these measures, which seem to be the most important? Which one is the most frequently reported?
All measures?
Yeah.
The itch, the itching measures, or all measures?
I mean, for the overall.
Dermatologic quality of life and itch measures, and the IgE measures. It measures the nodules, a number of the nodules. This is the main outcomes in the studies, but also have head scores, and that's all, actually.
Yeah, thank you.
It was a wonderful presentation. So, formerly I knew some case reports reporting that prurigo nodularis could be managed with omalizumab. And what did you find during your literature research? Is there a relevant overlap between the two patient population? Chronic spontaneous urticaria and prurigo patients. Because there is a common medication, the omalizumab, which may be given to both of these patient groups, but
yes.
Are this mentioned maybe in the studies that there is an overlap between these two patient populations?
I haven't found, but I'm currently working on my full text selection, but no, actually no.
If I may ask, I would like to know, we know that omalizumab is anti-IgE, as you mentioned. The novel biologicals, do you know the mechanism of those?
The novel?
Yes.
One of them is legalizumab, which is target the free IgE2, but it is stronger than omalizumab. However, interestingly, it is dose dependent according to the studies. And I think that the other novel biologics, which efficacy is good, the BTK inhibitors, it is FC epsilon receptor inhibitors.
Thank you.
You mentioned that there are several different ways of quantifying itch, all on a scale of 1 to 10, but you're not trying to combine them, right? You're going to analyze them separately.
Yes,
Okay,
of
even
course.
if it's one. Okay, thanks.
Okay, of course.
Regarding prurigo, what do you think? Is it a known entity of the disease always, or is there anything other disease in the background very often?
No, I think it's more patients with prurigo than we know, but we can recognize because not a well-known disease in the other departments, I mean.